got this, and I got you.
Hello, everyone, and welcome back to Care Conversations with Griswold Home Care for Chevy Chase. I'm Erin Pickrell, Director, and each month we sit down with a trusted professional in the care and wellness community to help share information, practical guidance, and local resources to help everyone age in place. Griswold has been supporting families in our community for more than 5 years. Whether it's short-term recovery care, support for veterans, or 24/7 in-home assistance, our mission is always the same: to make aging in place safe, meaningful, and supported. Today, I'm excited to welcome Dr. Nadia Sirdar of Bethesda Modern Primary Care. We'll be discussing healthy aging, preventative care, ways families can better advocate for loved ones, and how modern healthcare is evolving to better support patients. Thanks so much for being here today, for having us in your beautiful office. And can you tell us a little bit about your background and what inspired you to open Bethesda Modern Primary Care?
Sure, absolutely. Thank you so much for having me. So one of the big sort of drivers for building this practice has always been the gap that I saw, in hospital medicine. Working for 10 years at Sibley, in the inpatient side, we saw a lot of older folks that were presenting with, catastrophic, like end-stage disease, and they were often times after the hospitalization really debilitated and going to like acute rehab or subacute rehab, and it was harder and harder for them to get back home. So when I built the practice, the people I had in mind were the folks that could have had preventative care earlier in the trajectory, so that A, they don't present with such severe disease, but B, so that they're able to sort of age in place and thrive as they get older. And the whole concept is direct primary care allows us to kind of eliminate those barriers to care. So when people ask me what the difference is, they often will ask, like, insured practice is about 3,000 patients per physician. Concierge practices typically have around 1,000, give or take. And then direct primary care will often have like 500 or less. And typically what we do is like a membership-based model. So you pay for the month or the year, and then that includes all your primary care. And then some people will use their insurance. Most people do for anything tertiary. So specialists, hospitalizations, labs, medications. But the whole concept is to get all your care under one umbrella, so that you have like a quarterback and you have one team, and then that person knows you so well, it keeps you out of urgent care, it keeps you out of the ER, and hopefully keeps you out of the hospital.
Yeah, absolutely. And what are the biggest things adults often overlook when it comes to staying healthy as they age?
Absolutely. So one of the big factors that I find is the opportunity in midlife to make big changes, or at least to implement better sort of long-term health strategies. So for women, a lot of that is, strength training, bone building, ensuring that their bone density is at their peak before they reach perimenopause and menopause. One of the top reasons for admission to the hospital is often falls, and those falls tend to have a lot of morbidity and mortality associated with them. So if you're strong and your bones are strong, the fact of the matter is you could fall but maybe not break a bone, right? The other common cause of admissions to the hospital amongst females older than 60 has historically been urinary tract infections. So there's a new GU syndrome of menopause that I'm very passionate about, where we tell postmenopausal women that vaginal estrogen is actually the standard of care, and it's a primary prevention of UTIs. So for women, that's kind of what I emphasize. For men, it's very similar. It's diet, exercise, sleep, but essentially the movement is medicine type of like impact, I think, has the highest impact long term.
Yeah. So like movement as in exercise and
so it can be well, the thing is, it's so funny is I think we all know that you're supposed to get up and move, but our lives have become so sedentary that we spend like 12, 14, 18 hours a day sitting or laying down. And so what I always advocate to my patients is to break it up. So like I'd say like 30 minutes or an hour to take like a 15, 20 minute like snack break. But instead of a snack, you're just moving, whether that's like doing squats or going for a quick walk or going up and down the stairs. And it seems kind of silly when you first start it because you're like, what am I doing? I have work to do. But the idea is that you're actually more focused and your energy level goes up quite a bit when you're moving your body. Your body was meant to move. But then I also think it's important to be cognizant of the fact that you might have someone in their, mid to late 70s who's not going to start going to the gym tomorrow. So even like gentle exercises like Tai Chi and yoga and like really balanced exercises are huge. So often one of the first evaluations I do is ask my patients to do the sit to stand test, see how fast they can go from sitting to standing and sort of stay steady.
Yeah.
So yeah, there's like a lot of different ways to sort of get a snapshot of someone's like long-term health, but the movement is medicine is very helpful to sort of integrate into your daily life.
Yeah, definitely. Are there any, simple lifestyle changes that can have a major impact on their long-term health?
Yeah, so I would say, I think in the era of GLP-1s, it's really important to maximize your muscle building and make sure that you don't fall into the category of losing both fat and muscle. It's important to lose the fat, especially the abdominal or visceral fat, but you also want to ensure that you're doing the right things with diet and exercise to maintain your muscle mass. One of the things I'm seeing more and more that's concerning to me is older patients presenting with 3 months, 6 months, 9 months on GLP-1s, and they're like, oh, I lost 50 pounds, it's awesome. And then you get them on like a scale to see what their fat mass is versus their muscle mass, and they've lost a lot of both. And that's really something you don't want. So I think there's like this sort of sensitivity towards not just bone strength and like balance, but muscle mass as sort of being a focus, not just in midlife, but kind of midlife and beyond.
Yeah, definitely. That's interesting. I do hear about GLP-1s and obviously losing muscle mass too, and that's, you don't want that. And for families and caregivers supporting aging loved ones, what are some ways they can better advocate for their loved ones during doctor visits or hospital stays?
So that's a really good question. So number one, the biggest sort of impediment, I think, to getting good care is the translation of information. So oftentimes as a hospital medicine doc, I would present to the bedside really early in the morning with rounds to see my patient, and then I would leave after, let's say 10, 15 minutes. That's not the time that their loved one is going to be at the bedside. So what I started doing for my older patients is I would call on the phone and put on speakerphone either their spouse or their whatever, it's usually the eldest child, but the adult child that's kind of helping manage their care. And I would say the communication is the biggest factor. And to ask your doctor kind of very straightforward questions like, how is this going to change what they look like at home? How many days or weeks is it going to take for them to recover their previous function? What are the things that I can do to get the home ready for them when they come back? And then I also think caregivers should kind of factor in the fact that they can't do it all, and to try to seek resources, whatever that is, whether that's through long-term care insurance, through services like yours, even their church or their community. The meal train is a nice idea, but it's also helpful to have like a chore train, like people who are going to help you with your daily life while you're caring for this person, because the ability to bounce is definitely a long road. And I think one thing that surprises people, most folks over 60, for each day of hospitalization, I would tell my patients it takes 1 week to recover. So if you're in the hospital even 3 nights, you're looking at 3 weeks of recovery.
Yeah. And, I think we do see people come out of the hospital wanting to go back to how they were before. And it does take a while, and it's really hard. But being patient with yourself or your loved ones is really important.
I think patience is helpful, but I think you need to have a game plan, right? Because I think the caregivers can't do it all. And so really to organize the PT, the OT, the speech, but then also to sort of ask the people in your community who are like, what can I do to help? Can you come and take us for a walk? Like, can you help me on the other side of the walker so we can go down the block and back? I mean, there's very discreet things you can ask for, but I think our community, the connections we have with each other have somehow broken down, where we don't want to impose on others, or we don't want to ask too much. And so there are things that we can pay for, but there are also things that we can do for each other that are meaningful, and even in small portions are like so exponentially helpful.
Yeah, definitely. And how do you see technology and telehealth evolving in
absolutely
primary care?
So I have quite a few patients with like neurocognitive deficits, whether they have Alzheimer's or Parkinson's. And I have used telehealth very successfully to be able to communicate with them when mobility is an issue. I will say that I encourage my patients to try to come to me so I can actually observe how they're moving. Are they moving in a steady fashion? Is their balance intact? You know, things that are like a nonverbal way of communicating with my patients. But telehealth is so helpful if I've already got an established patient, they have something going on that would be like a quick 10-15 minute call. But really there is something to be said for like eye contact and seeing the face and the expressions of your physician or your caregiver. And then it gives a chance of their loved ones to be at their side and say, remember, Dad, you said this thing was going on. Can you tell the doctor? Or they said that thing's wrong, but actually this is what they've been complaining about. So I think in that respect, it's very helpful. Number two, we are in a really lucky and like health rich area, but there, I should say like health care resources are rich here. In rural areas, it's a really big problem. And so I think telehealth for that space is so important, especially for the aging population.
Yeah, you're right. And getting to the doctor can sometimes, like if that is the challenge that's keeping them from the doctor, then telehealth is a great resource.
I don't think it should replace in-person care. I think we learned that during the pandemic. So as a hospitalist, I often saw patients with like very complicated, sometimes like necrotizing pneumonia that I wouldn't have seen anywhere outside of a textbook. But it was because they were diagnosed and treated wholly on telehealth. And no one put a stethoscope in their ears and listened to their lungs. And so there's something very valuable about the physical exam that really can't be overstated. But I think for maintenance and for check-ins, I think it's very helpful.
Yeah, definitely. And I think, truly those are really my questions. And I think like that is one way where direct primary care is really valuable, right? As you do have that time to see people, in person, maybe last minute, or like, I guess, how does someone find you if they're interested in learning more?
So I don't know how I got lucky with this website, but I have my website is BethesdaDoctor.com. They can book a discovery call. I'm on social media, on Facebook at Dr. Nadia Sirdar, and then on Instagram, same at Dr. Nadia Sirdar. But it's funny because I've been a little bit recalcitrant about social media because I've always been worried about kind of being unprofessional or somehow being in a space that's not safe for a medical professional. But what I've understood more and more is that this is where my patients are going for their information. And so if somebody who's knowledgeable is not going to show up, they're going to get their information elsewhere. So I do use my platforms to educate and empower. Whether or not someone becomes my patient, it's more important for me for people to have the knowledge so that when they go to their doctor, they go to whoever is in their community, they know exactly like how to advocate for themselves.
Yeah, absolutely. I mean, you're right. That's a lot of information on social media. And so of course it's important that, a knowledgeable source is there too.
Well, and it's like, there's a lot of like, I don't even know what the term is, but it's like a lot of inflammatory stuff is said in like a kind of sort of like make you click or make you kind of follow. And I get it. There's an algorithm for getting people to look at stuff, but I don't think it often is not very, very much based on real science and data, which is so important.
Exactly. Yes. Yeah. Well, and thanks again for joining us and sharing your insights with our community. And thanks to everyone watching this episode of Care Conversations. We're proud to support older adults and our, caregivers in the community. And be sure to follow us for more conversations, and we'll see you next time.